There are a lot of people who struggle with mental illness, depression, anxiety, post-traumatic stress disorder, obsessive-compulsive disorder, and pain syndromes. These issues can disrupt and even take over a person's life.
Many of these people give up hope of finding a treatment that works.
I was struggling with depression and anxiety, and I had taken medication in the past years ago, but got to a spot where my family was concerned about me.
Dr. Jason Friday and the compassionate team at Redemption Psychiatry have been on the forefront of treating patients using ketamine therapy, an important breakthrough in treatment.
So for the longest time, the treatments that we've had for depression, anxiety, PTSD, OCD, the goal has been to mitigate symptoms and hopefully to achieve remission from those symptoms. But often the medications, they help to basically treat a few of the symptoms, help to maybe help somebody sleep, reduce nightmares, give them energy, but the goal should be the remission of symptoms. So it should be to achieve a full remission. And unfortunately, not everybody is able to achieve that with conventional treatments such as medications and therapy. So we're exploring many new options in the treatment of these disorders, and more specifically, using ketamine infusion therapy has been an amazing breakthrough in treating the conditions such as depression, anxiety, PTSD, OCD. Goes well beyond what we'll be able to achieve with medication and therapy together. So it's very exciting, and even combining ketamine infusion therapy with other treatments such as transcranial magnetic stimulation and theta burst stimulation has taken the ability of the psychiatrist to achieve remission in the patients to a whole new level. And it's an exciting time to be a psychiatrist and to bring these kind of treatments to patients. Dr.
Friday and his team explain how ketamine treatments work.
So ketamine was actually discovered and approved back in the late 50s, early 60s, and it was initially used for general anesthesia and primarily in pediatrics. It was felt to be a very safe medication to use. And in high doses, we know that we can induce a general anesthesia and perform surgeries and the like. And in more recent years, there's been a flurry of research into finding out how ketamine can actually affect the brain in other ways, and using low-dose infusions that don't induce a general anesthesia and help the brain to function more optimally. But what it basically does is it affects NMDA receptors in the brain and glutamate pathways. And these are pathways and targets for medication that we don't use, and primarily because the way that it interacts within the brain would be unsafe to send somebody home with a pill that's going to affect their glutamate pathways or their NMDA receptors. But being able to administer a low dose of ketamine and block the NMDA receptors, we can actually help the brain to understand that we want it to function more optimally. So it gets a signal that basically says, engage, start working more on the pathways that are the primary activating pathways within the brain. And those primary activating pathways will help to interconnect the neurons and the neuronal pathways in the brain that affect so many different disorders. It's hard when you talk about treatments being something that's going to help out so many different things. It also sometimes instills a bit of doubt that something could work on so many levels to treat so many different disorders. But really what it's doing is helping the brain to function more optimally, which of course is what we need it to do, to repair the neural networks and to help to connect the brain's synapses, the actual communication from one neuron to another.
Ketamine therapy is usually done and can be done in an inpatient or an outpatient setting. It's generally done with a stabilization series, which consists of 4 to 6 treatments. Generally 6 treatments is what we recommend, and those treatments are spaced out over about a 2 to 3 week period. The infusions are relatively painless with the exception of an IV. That's hard for some people. However, we have very well-trained nurses, and it's relatively painless. Some patients even say they don't even feel it. And the infusion goes in through an IV pump. The actual infusion takes about 45 minutes. Patients are in the office for about an hour from start to finish. They're done in a very private room, a very comfortable setting with aromatherapy and blankets and pillows and a very comfortable plush recliner chair. and they are given music, or they can listen to their own music, and we just really try to provide a very peaceful and relaxing environment, and they're usually in and out within about an hour.
When you're in a pretty dark place, having some instant relief is a really big deal, you know, and it's relief that you're not going to find in, you know, a bunch of cocktails or even sleeping 12 hours. It's totally different than that. And puts you kind of in a place so that you can, the way I imagine it is two roads, and if you're going down a road that's dark and scary and muddy and horrible, the ketamine kind of picks you up out of the muck and the mire and puts you onto this new kind of pathway in your brain, one that's paved and sunny, so that you can kind of stand on your 2 feet mentally and think through things and kind of have just a more clearer navigational ability.
Redemption Psychiatry, improving lives with advanced treatments that work.